American Indians in Montana understand that there is strength in community. The COVID-19 pandemic has threatened the very connection to family and community that protects well-being and mental health. Social distancing, quarantine, and isolation are public health measures that, while effectively combating the spread of coronavirus, create a loss of connectedness that can cause mental health to suffer. Social isolation is one of many factors that contributes to suicidality. Montana's suicide rate is consistently one of the highest in the nation, with American Indian people at particular risk. Because of this pressing health concern, a team of researchers at the University of Montana's Center for Children, Families, and Workforce Development sought to understand the impacts of the COVID-19 pandemic on suicide prevention services with Montana's American Indian communities. 80 healthcare providers from all across Montana responded to the survey. Over 50% of respondents reported living in Montana's cities. 16% were from small towns, and 10% of providers were living on Indian reservations, including Blackfeet, Crow, Flathead, and Fort Belknap. The majority of providers confirmed that their American Indian clients have felt more socially disconnected during the pandemic. About 6 in 10 providers believe that the pandemic has made their clients less likely to seek suicide prevention services when struggling. However, the study also revealed a promising and effective practice for suicide prevention services. 98% of providers believe that telehealth is needed for suicide prevention practices with American Indian clients during the COVID-19 pandemic, and 75% of providers believe that telehealth is an effective suicide prevention practice. However, there are some barriers, the 3 main barriers being training, internet, and equipment. Less than half of providers reported that they had received training related to telehealth. And in addition, providers from cities in Montana reported having issues with internet speed that disrupted their ability to provide telehealth services. Lastly, the research revealed a telehealth gap, a large difference between the internet speed and equipment of providers compared to their American Indian clients. In conclusion, providers have increased their use of telehealth during the pandemic and regard it as a needed and effective suicide prevention practice. To improve access to this service in Montana, investments in broadband internet access and telehealth equipment for American Indians at risk of suicide are needed. Also, targeted training, especially for new telehealth providers, will help boost the effectiveness of the service across Montana. Reducing these barriers will improve access to this important suicide prevention practice, even after the pandemic ends.